Hello and welcome back to the 8th Annual Online ADHD Awareness Expo. My name is Tara McGillicuddy and I am the host of the ADHD Awareness Expo. I'd like to remind you to make sure you stop by our online exhibit hall, and if you have not signed up for our goodie bag, do so now. We have some great prizes in there from our speakers and our sponsors. And with that, I would like to welcome Dr. Roberto Olivardia to the ADHD Awareness Expo. In just a moment, we're going to be talking about ADHD and body-focused repetitive behaviors. But before we get started talking about the topic, Dr. Olivardia, can you let our viewers know a bit about yourself and how to get in touch with you after the expo?
Sure. It's great to be here, Tara, as always. I am a clinical instructor in the Department of Psychiatry at Harvard Medical School, and I have a private practice in Lexington, Massachusetts, where I specialize in the treatment of ADHD, executive functioning issues, as well as eating disorders, obsessive-compulsive disorder, bipolar disorder. And people can feel free to send me an email. My email is Roberto_Olivardia, which is O-L-I-V as in Victor, A-R-D-I-A, at hms.harvard.edu.
Okay, so let's get started talking about the topic. And I guess the first question is, what are body-focused repetitive behaviors? That's hard to say.
It is. It's a tongue twister. So body-focused repetitive behaviors, or BFRBs for short, is basically talks about certain conditions or habits that people have that include sort of compulsive behaviors, things like skin picking, trichotillomania or compulsive hair pulling, nail biting, nose picking. So these are all behaviors that have some sort of compulsive, repetitive aspect to it that people engage in with an aspect of their body. And this is an area that's actually taught very largely in the OCD or obsessive-compulsive disorder community, and is something that's been largely associated with OCD. But actually, I see a lot in my ADD patients, and something that I've been starting to research and write about in understanding that this is something actually that many people with ADD also struggle with.
Okay, so what are some of the common features of BFRDs?
Sure. So the common features, it usually starts with some sort of either visual or tactile inspection, whether it's somebody running, their fingers through their hair or maybe through their skin, and then identifying some stimulus that either feels not right in some ways, or in the case of skin, it could be a pimple, it could be sort of an uneven part of the skin with the hair, it could be something that just feels uneven or asymmetrical. And what happens in that moment to someone who struggles with these issues is that it's almost like they feel like they get sucked into a vortex where now they need to remove that stimulus. And so that could result in going to a mirror and actually picking, at the skin. It could be pulling that hair. It could be, in the case of like nose picking, it could be biting the nail in a certain, kind of way. And with these behaviors, unfortunately, it doesn't just stop there. It can then lead to visually or inspecting other aspects of that body part. And it could be something that people engage with sometimes for minutes or hours. Sometimes it's mindless. In the case of sitting and watching TV, many of my ADD patients will say they don't even realize that they've been picking at their skin or pulling at their hair or I have a patient that drives while pulling her hair and doesn't even realize it. And then at other times, it's a very mindful event, a very hyper-focused event that feels incredibly stimulating. And it is a very, very difficult behavior to stop. That again, when you hear people who talk about this is not the kind of general habit that people can just sort of stop doing. They feel like they're just sucked into this vortex where it's very, very overwhelming to stop the behavior.
Interesting. How does having ADHD predispose someone to BFRDs?
Sure. So with ADHD, what's interesting is that when we understand in ADHD, it makes perfect sense, actually, why people with ADHD are highly predisposed to BFRBs, being that, number one, there is a certain stimulation that people feel when they pick, pull, And what we know is that it results in probably some release of dopamine in the brain. There's a certain reward that comes from it. So unlike, when we hear about like pulling hair, we would think, well, wouldn't that be painful? But for certain individuals, and people with ADD would fall under this category, if you have an under-aroused state, and we know the ADD brain is a sort of under-aroused brain, it doesn't get registered as pain. It gets registered as stimulation. And so that stimulation is incredibly reinforcing, and the ADD brain wants more of it. The other thing that people with ADD, we know, struggle with are impulse control problems. So there are lots of people, for example, that might see a pimple and say, oh, I want to like pop that or squeeze that, but that could probably damage my skin, or that wouldn't be a good thing to do. And they can remove themselves from it. As we know, people with ADD have a hard time with impulse control, so they're just going to pop it and squeeze it. And I have patients who have done significant damage to their skin, significant damage to their scalp, to their nails, doing these behaviors. But in that moment, they're not thinking about the consequences. They're just really thinking about getting rid of whatever that thing is. There's also such sensory stimulation attached to it. Sometimes it's not even about, for example, something like trichotillomania or hair pulling. It's not about the pulling. It could be what they do with the hair afterwards. So some of my patients love the feeling of rolling the hair between their thumb and their finger. I have some patients that put the hair and rub their lips with it. There are actually patients that sometimes ingest their hair, even though that sounds really strange, but it's and same with nails, could sometimes actually eat their nails. People with ADD are really driven by feedback, and it feels very grounding to someone. Let's say if you have a pimple, even if it's a deep pimple, that when someone pops it, they don't feel disgusted by it. They actually feel the sense of like this sort of gratification, this reward, that something that was beneath their skin has now been expunged. It's out. There's a very clear beginning, middle, and end. So it's very goal-focused in a lot of ways, which is very rewarding for people with ADD who often go through life sometimes not always feeling like they're getting the results that they want out of everyday things.
Interesting. Now, what about treatment, or when should somebody seek treatment? I think a lot of us have gone through life biting our nails and probably wouldn't go to a psychologist or get treatment for that. So
yes.
When should somebody, whether it's for themselves or their child or someone in their life, say, okay, maybe I should seek treatment for this?
Absolutely. But I would say when it starts to really become something that makes it hard for you to do other things. So the patients that I see, they have a hard time, let's say, getting their homework done because they're in the bathroom for 2 hours picking at their skin. The physical damage that you might cause. I have patients that have significant bald spots on their head from pulling at their hair. Their fingers, their cuticles are damaged. They've caused bleeding in their nose from picking at their nose. So when there's physical damage, when you have a hard time getting other things done, when the patient themselves might say, this feels out of control, but I can't stop, like I cannot help it. And patients experience a tremendous amount of distress and a lot of shame around this. And I want people to know out there, approximately 3 million individuals struggle with clinical levels of these problems, not just the subclinical levels, but clinical levels. And it's something that a lot of people don't know about because it doesn't always seem acceptable to be like, hey, guess what? I get gratification from picking at my skin. And it's not always at the face. It could be skin on arms, on the legs, on the back, or their hair. So when it starts to get to those levels, seek treatment. There are people that specialize in this. And it's important to also mention, particularly if you have ADHD, that is in the mix as well, so that it's not just looked at from kind of the OCD lens, but understand that there's a certain stimulation that people are getting from it.
Yeah. And then something like nose picking, that's not socially acceptable. I just think I worked with preschoolers, I worked with middle school students, and I don't think any of us as teachers really realize that may not be just typical child behavior, that maybe there's something else going on. So
absolutely. I actually had a patient years ago, a young boy who would compulsively pick his nose, and he would actually put things, insert like little pieces of like string, like from clothing, in his nose so that he can then pick it out. And there was a certain sensation he would get from that he said was just, he didn't use the word addictive, but the way he described it, that's what it felt like. So a lot of times behaviors like nose picking, we think, that's poor manners or whatnot. But it's something important to pay attention to for people that have ADHD, that they could fall into these behaviors very quickly. Similarly with something like hair pulling, like I have a patient now who it started out just, like twirling at the hair. And then one day a hair accidentally got pulled out. That was the beginning. I mean, it felt like overnight this problem sort of just exploded.
Now, what about like chewing the hair, especially, someone with long hair does that. Is that the same type of thing?
It can be, yeah. So with, hair chewing, if you're not pulling at it, it might not cause a certain amount of damage. But if it's something that makes it hard to then do other things, or if you feel driven to do it, as opposed to something that, you might be doing to soothe yourself. For some of my patients, these kind of behaviors are very soothing for them, but it becomes a problem, almost like a drug, where it could be first 15 minutes of doing it, and then it graduates to a half hour to an hour, and it could really become a problem because you develop a tolerance sometimes for the behavior because it's literally the brain is responding to it almost like a drug.
So what are ways to treat these type of things or manage them or maybe even prevent them?
So the key treatment is behavioral therapy, which would include it's not enough to tell someone, oh, don't pull or don't pick. That's just not going to work. That it's really understanding that that person needs a certain level of stimulation, but we don't want that stimulation to be damaging to them. So to give you an example, like one of the things could be like for someone who's a picker, who's a skin picker, that they might get like bubble wrap, for example. And if they notice that they tend to pick while watching television, sit and play with the bubble wrap, and popping like the bubbles from the bubble wrap is very gratifying to them. It almost kind of serves like a certain sort of ingredient of what the behavior does. It might not do exactly what the skin picking does, but enough that it hits that threshold. So you're trying to find alternatives for whatever reinforcement they're getting from it. You're trying to do. So if someone's reinforcement is that they find it relaxes them, what are other things that we can do to relax them? But it will often include them needing, let's say, to use their hands or something that's tactile, that you need to use the same sort of ingredients, but not in that kind of way, as well as making it difficult to do the behavior. So some patients, if they notice trigger situations, like my patient that is doing it while driving, that hers is to make sure that both hands are on that steering wheel. And if she does remove a hand from the steering wheel, she has a squeeze ball in her car, and she'll immediately pick up the squeeze ball because she knows if she doesn't pick up that squeeze ball, that hand is going to go to her hair and she's going to start pulling, while driving.
So some of these fidget type toys may actually be beneficial for people who have these issues? Absolutely, are incredibly beneficial. I mean, these new fidget cubes, for example, are wonderful. Like those are like perfect things for people who engage in these behaviors, because a lot of these body focused repetitive behaviors involve the hands, and so keeping the hands occupied is essential. Okay. And are there any other options for treatment or dealing with this?
There are certain medications that can be helpful, but the medications are really, again, an adjunct to the behavioral therapy. The behavioral therapy is really the necessary, essential treatment. But there are medications that like Prozac, for example, has been shown to have a lot of efficacy with skin picking. There are other medications that tend to have more efficacy with trichotillomania, for example. But it really comes down to those two things, and then just general stress management, because stress can often be a trigger. But again, for people with ADD, boredom is often the biggest trigger for a lot of people, whereas with my patients with OCD who struggle with this, anxiety is often the biggest trigger. So that's, again, an important distinction of how ADHD plays a different role. The behavior is the same, but what brings someone to that behavior could be different.
What if a parent or somebody notices their child has these behaviors? The typical don't pick your nose where you're going to yell at a child, I'm guessing that's not going to work. How should they speak to the child or the person in their life?
Sure. I would say, first make sure that the person is aware that they're doing it, because strangely enough, a lot of people are not aware that they're even doing or engaging in that behavior. So first is to say, do you realize that you're doing that? And I don't want you to cause damage, because it's not, I think what shames people is to be like, oh, you're a disgusting person because you pick your nose, or you pick your skin, or you're a weird person because you pull your hair, as opposed to the message is, I don't want you to cause damage to yourself physically, and I don't want this to be a problem for you, something that you get sucked into. So how do you feel about it? Like, do you feel like it's something that's out of control? And start with that and helping them realize, what situations do you tend to do this in? Everyone has different trigger situations that they find themselves doing these behaviors. Helping them become just more mindful of it without shaming them, without judgment, and actually saying, you know what, I can understand why that would be gratifying. Like, even though, again, not everybody is going to fall into these kind of, conditions, but if you think of it as, imagine when something, when you feel really frustrated with something and then you finally solve it, that feeling is how people, when they engage in these behaviors, feel. It's very rewarding to them. So you want to say, I understand that if something feels rewarding to you, you're going to want to keep doing it, but we don't want you to hurt yourself in the process.
Okay. Great, interesting stuff. I mean, this is a topic that I don't think I've ever heard spoken about on ADHD, and it obviously affects a lot of people with ADHD. So thank you so much for discussing this. And we're actually towards the end of the video. Do you have any final thoughts that you would like to leave people with today? And could you make sure you give out your contact information again?
Sure. I would say that the final thought is really, to reach out to people and to know that they're not alone. That's probably the most important thing, because again, there's such tremendous shame that people have around this. Being judged as weird, as crazy. You are not alone. There are many, many people out there that are struggling with this, and there is lots of really good help and solid treatment to help with this problem. And people can feel free, if there are different parts of the country or the world, I would be more than happy to help direct people to resources in their area. My email is Roberto_Olivardia, OLIVARDIA, @hms.harvard.edu.
Oh, thank you so much, Dr. Roberto Olivardia, and thank you everyone for taking the time to watch this ADHD Awareness Expo video. Be sure to sign up for our goodie bag and to go by our exhibit hall. Thanks again.
Thank you.